Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Two of every 10 hospital deaths and 27 of every 100 inpatient deaths among children under 5 years of age are due to malaria. Uganda is ranked among the top 10 countries with severe malaria in Africa. This is because statistics show that more than 16 people succumb to the disease daily, thereby contributing about 5% of the global malaria deaths. As an effort to reduce the impact of malaria in Uganda, the Ministry of Health conducted a study on the use of a new diagnostic kit, and they are impressed with the results.
For the purposes of the study, we did what we call serial testing, and my colleagues have already said serial testing means I give you one test. When it's positive, I treat you. When it's negative, I give you a second test. So from the extreme right, you can see is that when we tested people in series, meaning one test after another, the positives who were on the CRDT can show you that we had over 11% positive at OPD, which is a pretty low number. But when we subjected those same people to another further test using the high sense, we were able to pick up almost twice the number of people who had been sick.
The study conducted in Impigi district shows that the existing malaria rapid diagnostic testing kits are unable to detect lower levels of malaria parasites in the body.
There is a 50% increase of previously undiagnosed cases. Then we go to the pregnant women who are coming looking for care, but they are not sick. But as our new policy, we offered them, as part of the study, we offered them a test. We used high sense and we found 13% positive. When we used the CRDT, we found 7%. So it is also agreeing with what we had previously seen at the OPD.
The ministry's permanent secretary, Dr. Diana Atwine, says they are working to incorporate the new kits in the existing health system.
Our strategy will only succeed if we can get to the source of malaria and we treat it and eliminate it. The steps that country will take over the next few years will lay the ground for elimination.
Dr. Jimmy Opigo, the manager Malaria Control Program, says a new policy on testing has been developed and will be implemented.
All suspected malaria cases should be subjected to testing with a quality assured test on a parasite-based diagnosis. Also, we have now decided that all pregnant mothers shall be screened for malaria. Previously, you know, we are only screening pregnant mothers for syphilis, for HIV. We have just been doing only presumptive treatment with Fancida. So we like the first contact, we screen the mothers and we treat them to prevent the complications which come out of malaria and pregnancy. Also, a decision has been made that RDTs will be used in all levels of service delivery because they are a simple point of care test.
Dr. Atwine wants schools to be included in the ministry's program so they can be supplied with testing kits.
If we are saying everybody who is going to be treated must be tested first, why can't we also introduce that in schools? So that when a child is sick, and this is the majority of our children are in boarding schools, but they always treat blindly.
The Ministry of Health is currently distributing mosquito nets across the country in an effort to fight malaria. More than 8.6 million nets will be given out to over 1.7 million households in the second ongoing wave in Western Uganda. According to the World Health Organization, proper use of mosquito nets has proven to be efficient in prevention of malaria. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life. With support from the Ministry of Health, procure, store and distribute essential medicine and medical supplies to all government health facilities